Atropa belladonna, deadly nightshade. Botanical description. Atropa belladonna is a perennial poisonous plant with a very long primary root, from which numerous erect, blunt-angled, highly branched shoots grow each year, reaching up to 1.5 m in height. The leaves are arranged in pairs in the upper part of the stem, one large and one small, opposite each other. Between the leaves, on long pedicels, are solitary, drooping flowers, brownish purple on the outside and dirty yellow inside, with purple-red veins. The ripe fruits are glossy black, juicy berries about the size of a cherry. It blooms from June to August. The plant is in the Carpathians and their foothills, in western Ukraine, and in the mountain forest regions of Crimea. It grows in deciduous forests, among shrubs, and on young clearcuts, mainly in open areas. Natural populations can be used as a seed base for breeding work. Belladonna is cultivated in Ukraine as a medicinal plant. Harvesting and active substances. Leaves, herb, aerial parts, roots, and stems are used as medicinal raw materials. Leaves are collected 2 to 4 times during the summer. At the beginning of flowering, the lower leaves up to the branching point are removed. At the end of flowering, leaves are collected from developed branches. Finally, at the beginning of seed formation, the plant is cut at a height of 10 centimeters above the ground. After the last harvest in autumn, the roots are dug up, washed, cut into pieces 10 to 20 centimeters long, often split lengthwise, and dried. Leaves and aerial parts are dried quickly in special dryers at 40 degrees Celsius, while roots can also be air-dried. The plant is cultivated in one place for 5 to 6 years. Shelf life: leaves, 2 years, roots, 3 years.
Warning: the entire plant is poisonous. During harvesting and drying, avoid touching the nose, eyes, or lips, and wash hands thoroughly afterward. The aerial parts contain flavonoids and oxycoumarins. All parts of the plant are toxic and contain alkaloids of the atropine group, roots up to 1.3%, leaves up to 1.2%, stems up to 0.65%, flowers up to 0.6%, ripe fruits up to 0.7%. Atropine can cause severe poisoning. In addition to atropine, belladonna contains hyoscyamine, hyoscine, scopolamine, apoatropine, atropamine, and belladonnine. Cuscohydrin is found in the roots, and scopoletin is present in leaves and roots. The highest alkaloid content is found in leaves during budding and flowering, in the whole plant at the beginning of seed formation, and in roots at the end of the growing season. Uses of Atropa belladonna. Preparations of belladonna are used as strong antispasmodics for gastric and duodenal ulcers, chronic hyperacid gastritis, pancreatitis, chronic colitis with pain syndrome, bronchial asthma, cholecystitis associated with gallstone disease, renal colic, functional disorders of the autonomic nervous system, allergic conditions, insomnia, increased excitability, neurogenic menstrual disorders, pulmonary tuberculosis, hemorrhoids, and Parkinson's disease. Contraindications: belladonna is extremely poisonous. Use only under medical supervision. Contraindicated for pregnant women, breastfeeding mothers, patients with glaucoma, and cardiovascular diseases. For medicinal purposes, leaves, Folium belladonni, roots, Radix belladonni, and herb, Herba belladonni, are used. Leaves contain alkaloids, mainly hyoscyamine, as well as scopolamine, hyoscine, methylesculetin glycoside, asparagine, and resinous substances. Roots contain up to 1.5% alkaloids, mainly hyoscyamine, methylesculetin glycoside, and up to 12% tannins. Pharmaceutical preparations, extracts, tinctures, and modern galenic drugs are produced from belladonna leaves. They are used as analgesic and antispasmodic agents for bronchial asthma, gastrointestinal diseases, and morphine poisoning. Hyoscyamine dilates the pupils. Tinctures and extracts of belladonna are used in medicine as analgesic and antispasmodic agents for diseases of the gastrointestinal tract, nervous system, and other conditions.
Methods of use. Mix 30 g of crushed dry belladonna root with 100 g of activated charcoal, pour in 3 glasses of dry white wine, boil for 10 minutes over low heat and strain. Take 1 teaspoon 3 times a day before meals. After 3 hours, consume a small amount of ground nutmeg or chew calamus root. Continue treatment for 3 consecutive days. Used for Parkinson's disease. Atropine is often used as an antidote in poisonings with morphine, carbacoline, muscarine, pilocarpine, toxic substances, and certain mushrooms. Belladonna poisoning. In poisoning, nervous system excitation is quickly followed by depression. Fatal cases may occur. A characteristic sign is pupil dilation. Treatment: gastric lavage, in severe cases, cardiac and sedative therapy. Symptoms of mild poisoning, after 10 to 20 minutes. Dryness and burning in the mouth and throat, difficulty swallowing and speaking, rapid heartbeat, tachycardia, hoarseness, dilated pupils unresponsive to light, impaired near vision, photophobia, visual disturbances, floaters, dry and flushed skin, agitation, sometimes delirium and hallucinations. Severe poisoning. Complete disorientation, intense motor and mental agitation, sometimes seizures, high fever, shortness of breath with Shane, Stokes respiration, cyanosis of mucous membranes, weak irregular pulse, drop in blood pressure. Death may occur due to respiratory paralysis and vascular failure. A specific complication of atropine poisoning is trophic disorders, severe swelling of subcutaneous tissue of the face, forearms, and lower legs. Warning: do not self-medicate. In case of poisoning with belladonna berries, seek medical attention immediately. Interesting facts. The species name belladonna comes from Italian and means beautiful woman. In the past, Italian women instilled belladonna juice into their eyes to dilate pupils, giving them a distinctive shine. They also rubbed the berries on their cheeks to create a natural blush. In Old Slavic regions, the plant was known as krasen, beautiful one. Another name, mad herb, comes from the fact that atropine can cause anticholinergic delirium, accompanied by intense, sometimes leading to aggression and frenzy.